I'm Lacey LaGrone. I am starting with my disclosures here. You've met my sister before. She's made the joke of who's older. When I looked at this slide, I think you'll see that I've never had to have a disclosure slide before, and I do have no financial relationships, but there's someone here who looks disturbingly similar to me. And she and her colleagues at the Boston Consulting Group, the UX guy who you'll see this morning, these are people from the private sector who are donating their time for free. I have looked hard in that gift horse's mouth. I encourage you to do the same. And they really are people who are at the top of their field in the private sector. And apparently there's this phenomenon where you get really good at what you do, and we don't have to face this. And they go, but why am I doing it? And so then they move into cause work. And so we get to benefit from that today. And then we'll talk in the next few days about what's a sustainable structure, in addition to, in the words of my dad, living off the fat of the land is what we're doing right now. Okay, so my job right now is just to level set, to orient you. What we're going to do over the next few days is a little different than what we often do when we fly to a meeting and sit in a conference room. We are going to actively work together, so you'll have to hide if you want to just answer your email, because otherwise we'll interrupt you and call on you and ask for your input. This is a see something, say something space. We're going to actively work together to align on problems. You'll get more framing on that this morning. Last year, we really focused on making sure we agreed on the problems, co-design solutions, and then deliver those solutions at pace. Who are we? We will send out the metrics after the fact when you guys do a survey and we capture the granular detail. But big picture, I'll say that we are anchored in the principle of some of our excellent mentors of be diverse in your diversity. And so you are here because you are representing a voice that is essential to solve this problem. And then in addition, this year, we really focus on design thinking. First year, we are broad in getting input, and then the second year, we're getting strategic about, okay, we agree on what the problem is, how are we going to solve it? And so how are we going to make some movement on this over the next few days? So our anchoring framework is the Design for Dissemination and Sustainability framework. Implementation science is very jargon heavy. Big picture, this is like a SOAP note. Imagine if we all wrote notes about our patients or whatever your field is, if we just had narrative text without any framing. Implementation science is meant to help us see our blind spots and be more intentional and strategic about how we organize ourselves. So last year, we focused on conceptualization. Again, that's aligning on the problem, determining the need and demand, and we use this minimum viable product approach. And the principle here is that oftentimes we have an ideal in mind and we slowly start working towards that, but then by the time it's actualized, it's actually not ideal anymore. The context has changed, our resources have changed, et cetera. So if you're trying to get from point A to point B, and you go, well, a Tesla would be great for that. Let me give you a tire today, and next year I'll give you a windshield, et cetera, et cetera. Instead we go, let's get a skateboard, wear a helmet, and then we're going to turn that to a scooter and a bike and et cetera, so that we're always making movement and having high expectations, but also being grateful and encouraging ourselves when we make a little progress. And so this is the output from that first year. We're about 50% new, 50% present last year, so it's a mix of people who provide some continuity, but then also some new voices. And obviously you're not meant to read this. You're going to spend like 2 hours this morning digging in on this and making sure that we all understand, reflect, and are agreed on the objectives. And then in between, we've had the opportunity, thanks to the American Association for the Surgery of Trauma and other organizations, to do some complementary research to make sure that it's not just the 80 people in the room and the lovely people online who are participating who agree on the problem, but that if we go out of this space, we've done interviews with rural injury providers. We've got a lovely med student from Colorado now doing this similar work within the emergency medicine community, thanks to Chris King and his colleagues, Nick Cozy, who are here in a qualitative and quantitative fashion. We've done some in-depth stuff outside of the U.S. Most of the qualitative work has been in Peru. And then we've done quantitative work across the Americas. Again, basically just saying, when you have clinical uncertainty, what do you do? And what do you want from the resources that you're going to? Gabriela Zavala-Wong wrote this lovely systematic review that'll be in the supplement from last year. And I just call out that this is published literature, English and Spanish, for clinical guidance in injury. You can see the volume of production, but also the citation metrics indicate that the whole world, for better and in some cases for worse, is looking to the U.S. for gold standard clinical guidance about how to ensure that every patient gets optimal care, regardless of their setting, et cetera. So the first objective, why you schlepped yourself out to Chicago for 2 days in the winter, is first we're going to make sure that we all agree on this first part, that we all agree if we conceived of the right problem, we make sure that we're iterative, that we don't go chasing something and getting off in an eddy. And so that's what the first half of the day will be about today. The next part that we focus on is the design. In this, we look at iterative co-design of solutions to problems identified last year. So last year, we mostly talked about what the problem, but we started to conceive of and how might we chase that? And so you'll see some prototypes today and tomorrow that were designed in response to the input we got last year. And these are prototypes. They are meant to be broken down and built back up again. So again, this is a place that please don't sit on your feedback, right? Don't tell us 10 years from now that it was a bad idea. Tell us today. So you'll do some user experience testing this morning to have an interface with the central repository and an app that was developed. You'll also have an opportunity to engage with society leadership because our second objective was collaborate instead of compete in the development space. And then we get to the hard stuff. So those first two things, we think we've made some traction on a solve. And then we get to this laundry list of, yes, and the output needs to be way better than it is now. It needs to include the patient voice. It needs to include trauma-informed care. It needs to have more diverse authorship. Importantly, it needs to be relevant to different resource settings, right? Even in Loveland, Colorado, there are times where there's something that's published that's not relevant to our context, and we know that that's true to varying degrees across the U.S. and beyond. We also get into this space where people start to go, yeah, but wouldn't it be great if we could push gold standard information out and then get feedback on the output of that application at the bedside, and then use that to adapt the guidance and then keep drawing that circle. And so we have had so many conversations where people kind of have the aha moment, and everyone a little bit feels like they invented the internet because they go, oh, but it would be great if it went like this. And if this is just an image of if you put learning health system into Google Images. And the reason that it's still an aspiration and something that lights our eyes up, we think is, in the words of some really smart people here, that people in process is hard, tools are easy, right? The tech isn't what's lagging. It's collaboration instead of competition. It's alignment of incentives. It's making sure that diverse and the right voices are in the room so that we develop something that's actually useful to our end user. So in the afternoon, we'll get to see some really impressive work by some leaders in the field who are actualizing it and who can give us a sense of agency that this is possible, and that if we work together, we can really scale on the great work that's being done. We also think, a little megalomaniacal, that right now is the right time in history. So we'll go more into this in detail, but there are some things about right now that make it so that we believe that this is imminently feasible and it's kind of a tipping point. One, we know that Gen AI to many of us is a black box and that it's the bogeyman, et cetera, but what we do think we know is that it's really good at taking a lot of information and then condensing it down and putting out a different output. It needs to be done responsibly with subject matter experts and ethicists involved, but that some of the bottlenecks of getting the evidence out really can be augmented there. We also know that there's a global movement for standardization of information, that if systems don't talk to each other, then we're all creating our own little bespoke, beautiful solves. And then if our chief technical officer changes or the funding changes or whatever, then it dies. And the whole world is doing this over and over and over. But if we could make those communicate with each other and have some central ecosystem where we can say, oh, you've got to solve for that. Well, it speaks the same language as mine. Let's add that into my system and we could grow this together. And so those are acronyms that people in this room know a lot more than I do, but there's essentially nonprofit, ecosystem, global movements around standardization of information and the framing that this information belongs to the patient and not to the industry. We've also, at a time where some societies, some people who are content generators are recognizing, oh, this stuff is valuable, and potentially it could generate revenue, which would then allow us to do this whole thing a lot better than we are now. So literally at my hospital, I saw a flyer that said, Society of Critical Care Medicine ICU Liberation Bundle. Scan this QR code and take it to your information officer or CTO or whatever and get them to download into your Epic system today. And it's co-licensed with SCCN. So I don't know what they negotiated, but I suspect that they're getting some revenue from that, which is great because as we'll hear some tomorrow, you know, the National Comprehensive Cancer Network is really great at developing guidelines. They have 120 employees. And most of us are doing this bootstrappy. And so another central hypothesis for us is that we've gotten as much as we can out of the system as we've built it now. And now we need to look for some opportunities to kind of, in the words of Avery Nathans, professionalize this to make it more sustainable and have a more ambitious output. And then importantly, and to me most importantly, is that there's this beautiful moment where the needs of the military, the US military, the deployed soldier, rural United States, and the global majority are aligned. Like we have done the research in those different contexts, and there's a lot of literature and a lot of voices in this space that they all want the same thing. So what a beautiful thing where you have complementary human resources, financial resources, and needs. And then we think, so when we talk to people, and you'll get to hear from some of them, people who have dedicated the last, 10, 20, they're not old enough for it to be 30 years of their lives to realizing this evidence to practice approach. I always pitch that injury is the right use case, right? That somebody just has to show that it can be done. And then we recognize that this is something that's relevant to all of healthcare, not just injury. And a couple of reasons why I think injury is the right use case is we have a system. We have the verification review committee. When I take implementation science classes, everyone kind of jaw drops when I go, well, we have a switch that we can flip in trauma. The verification committee can say, this is a new standard, and you just flip the switch on doing this. And we recognize there's pros and cons, et cetera, and implementation is complex, but we do have a system beyond what a lot of our other health disciplines have. And we can do hard things together. So we have a global imprint in the trauma community. The whole world looks to ATLS, et cetera. We've done hard things before, and we think that this can be our one of the many things we do that benefits the global community. Principles to anchor us in: if you want to go fast, go alone. If you want to go far, go together. We kind of want to go fast and far, but we know that we definitely won't be able to go far if we're not together. And so there will be some times that are uncomfortable because when we do postmortems with people who know about this and say, well, why didn't it work? Because people, people at the grade McMaster course said, like, yeah, we had these same conversations in COVID. We said, wouldn't this be the right time to all work together, to push out clinical guidance and get feedback? And we said, well, why didn't it happen? Literally, the words that they use are tribalism, lack of aligned incentive, lack of collaboration, et cetera. And then look at your programs, and if you're participating in any way of having an assignment, you might get kind of nauseated. You go, huh? Like, there's a lot of moving pieces. And Ashley is a fantastic leader and partner for this whole endeavor because she's incredibly organized and intentional. And it's complex right now, but we would argue that simplicity on this side of complexity is foolishness. Simplicity on the other side of complexity is wisdom. So if what we're trying to do feels hard and big, et cetera, that's perfect because it is. And we think if we work together, we'll be able to get to a simplicity that benefits our patients and is sustainable. There's my cell phone number. If there's anything that we can do to improve, let me know. And then now I'm going to do some housekeeping. I want to make sure I'm on time. Okay, perfect. Please vote for superlatives. Elliot Hout is home. Send him your love. We had people dropping like flies. You guys, this is kind of like, the apocalypse type situation. You guys have been left behind because lots of people are sick and at home. And so, but he's our champion, and we'll give these awards at the end. There's an option for a write-in. I would encourage one possible write-in might be most harrowing journey here. We have some colleagues who are here from Canada who literally drove all night because the Toronto airport was closed. And so they the flight was canceled and they drove all night. And there are boxes behind that wall across from the gallery, the art gallery. The silent auction is this beautiful moment where we really get to steepen the story of patients and caregivers of patients, and we are so privileged to have Kelly Lang here, who is a patient advocate and who's, you can learn more about her story and read those quotes, but she has been part of our initiative and she's really active in the patient space, and also her daughter, and she both suffered an injury. And then the art that it's paired with is an artist who has a somewhat similar story, whose 4-year-old daughter sustained a traumatic brain injury. So enjoy those if you want to bid on them. If you don't bid on them, it's okay. We'll take them all home and be delighted. Where those funds will go is to the Friends of Center, which pays for things like this: travel awards and scholarship, proposal writing, and administrative support, staff training, and compensation for patient partners at Center. And then this person was a speaker last year, and we got rave reviews, and again, kind of anchoring us in the fact that we all kind of have to have our internal dialogue sorted in order to manifest effectively as team players externally. And so she is a self-compassion, mindfulness, professional coach, et cetera, giving away free sessions. And for our remote attendees also, she's remote, so this works well for everybody. Okay. And then I am delighted, and I cannot remember who I asked to, oh, Arnold. Okay, Arnold, you are up. I'm gonna have Arnold win last year's keynote. I'm so excited. Present today's keynote.